Thank you very much to HIPRA to inviting me for this very, very nice venue. I hope that I'll be able to tell you a little bit about the future here in Europe. I'm not a part of the European Commission or anything, so what I did when I was asked to make this presentation was that I called a lot of my hotlines and asked them what they knew, so it should be quite updated. If there's some things that I miss, I apologize very much. If there's some countries I forget or anything, you can tell us afterwards at the open session and scold me, okay? All right. First of all, the buzzword in Europe is really One Health. And by One Health, what we're talking about is that the health of animals and humans are closely related. Sick animals may give sick humans and the other way around. But to be honest with you, all focus is really on the One Health of humans, where the animals in the European policy is maybe not so important, their health. It's more in relation to the human health. Okay? The one thing that they focus on, which is they're very concerned about, which Bart was also talking about, is that when you treat an animal, you get resistance. And this is really what they're worried about, the resistance which carried on to the abattoir through the meat product and reaches the human beings. And as Bart, he mentioned, it's the ESBL which they're very concerned about. And in the political mind, ESBLs are very much associated with the use of cephalosporins. So they're very, very worried about the consumption of cephalosporins. Also, they're worried about the other thing that Bart was talking about, which is the livestock-associated MRSA, which is more, you can say, an environmental issue. It's not foodborne. It is something that you may get on your nostril, for example, when you're working in a herd which has MRSA. You can control, for example, the consumption of antimicrobials, or you can control the things going on at the abattoir, or you can control what's going on with the meat product. That's one of the places that the European decision makers can go in and control issues. The effect of their implementations, they can, for example, measure through looking at how is the consumption of antimicrobials, how is the prevalence of resistance in animals, meat products, and in humans. Unfortunately, I think they sort of forgot looking at the prevalence of animal welfare. The European Commission has made a 5-year action plan against the rising threats from antimicrobial resistance. Just in this moment, they're actually sitting assembled to make the next 5-year plan. I think HIPRA would have loved somebody from the European Commission today here, but they're all very busy making this next plan. The new 5-year plan, I said, was under development, and I'll try to work you through 5 of the most important points, what I find is most important in this 5-year plan. Their wish is to make harmonized systems on surveillance and on the antibiotic consumption and resistance. So they want to have this harmonized all over Europe. They want the way of monitoring it to be comparable between member states, and they would like to allow comparison between human and veterinary data, and we're really not very far yet. They realized this, so they started a project under the European Medicines Agency, the EMA, and just here a couple months ago, the 4th report came out from EVA, because what they can get hold of is through the pharmaceutical industries, they can get the sales of veterinary medicine in Europe. They've got it from 26 countries. These countries are very, very different in the construction of animals. Like in Denmark, we have an extreme amount of pigs and a huge pig production. Holland may have much more, for example, veal than we have. So how to compare that? Well, then they invented a parameter called the PCU, which takes the type of animal into account. I can't manage to go into detail with this, but it actually makes the numbers quite comparable. So you can see down here is mostly actually quite a number of the Nordic countries. So when it's cold, we use less antimicrobials. Is that the relation? While the hot countries with the good food, they have the high consumption over there. Cyprus, Italy, Spain, Germany, for example. Things are changing, I would say, but still. So that's a way of monitoring, one way of monitoring. In the future, and they had actually hoped already to be there now, they would be able to look at it at an animal species level. They had actually hoped to be out there with 7 countries on swine. They also want to look at it on production category, and there I guess it's something like, for example, organic production systems compared with conventional. And also an indication so you can see what they're treating against, for example, pneumonia, lameness, or whatever. National surveillance of consumption. And now I have to tell you, when I write consumption, it's antibiotic consumption, antibiotic use I'm talking about. It's not food or beer or anything else. It's antibiotic consumption I'm talking about. They wish it's all countries that survey this, but in reality, what they told me was that this is mostly the Nordic countries, and Holland and Germany is on its way, but I could hear in Bart that Belgium seems as if they're also working on it. And these countries, like the Denmark you see there, that's from Denmark, then there's the Swedish, the Norwegian, and the Dutch, they send out really nice reports every year telling what the results are. An example here is from Denmark, where you can see the consumption over approximately 20 years. The purple one, the dark one, is the growth promoters, which we stopped using. Then the lighter blue is the therapeutic use of antibiotics. The green is the human use of antibiotics. This is just to give you an example of what it could look like. Then we have the Dutch that have also something here in their Maran report, where you can see that here they have chosen to show it in a different way, where you can see the various kind of antibiotics they're using, and you can see what a tough effort they've had to reduce their consumption of antimicrobials. In 2013, they reached a little bit above 200 tons, which is approximately the double of what we use in Denmark, but they are almost down on Danish levels by now, as far as I understand. So this is an overall way of showing the consumption. In Denmark, we also go down and we show it on species level, where we have made a kind of parameter which does that we can compare the species. So here's the marine fish, for example, the swine over years, turkey, dogs and cats, fish, and broilers. And if your nose, you want to know where the cattle is, they're somewhere between the fish and the broilers. So they invented this special parameter called the DAPD. That's the way we do it in Denmark, where we say that each animal, when it's treated, it gets a standard dose, and then you divide all the standard doses multiplied, then you divide it with all the animals at risk, and then you get the DAPD, something like that. In Denmark, we can even look down at the level of the herd. So each herd owner and his advisors, they can draw these drawings. Each bar shows how much he's been using within a month, over the month. The yellow chart is the rolling 9 months average. And the blue lines are respectively the national and the regional average. So he can benchmark his consumption. And I guess maybe you can see that when the authorities see this, they really also have a tool to regulate all the way down to the herd level, because it's really become transparent what the individual farmer is doing. Also, the farmer, he can look at here at the top here, he can look at exactly over the month how many tetracyclines he's been using, macrolides and so on, and he can see at what indications he's been having his main consumption, for example. So that can also be used as an advisory tool. The European Commission also wants the surveillance of resistance. They want all countries to do that, but in reality it's mostly still the same countries that also monitor the consumption. The bacteria that they want to have monitored is also what Bart more or less said. It's a zoonotic bacteria they want to follow, Salmonella and Campylobacter. They want to follow the indicator bacteria, which are called Enterococci and E. coli, with emphasis on the SBLs. And these indicator bacteria give sort of a kind of feeling of what the environment looks like with resistance, with emphasis on resistance. Thank goodness they also remembered the animal pathogenic bacteria, so they didn't completely forget the animal welfare here. They want the tools on surveillance to be harmonized and the interpretation criteria to be harmonized so we can compare countries. And they actually want to audit member states to see if they follow their obligations. That's what they write. So that sounds a little scary. And in 2015, 17, and 19, they want to look at bovine samples. I just wanted to mention that since you're bovine practitioners in here. Here's an example on what I call an easy interpretation of resistance data. It's from Holland. And it was because Bart, he mentioned that they had found in Belgium linear relationships that you can find sometimes, and other times you don't find it at all. And here, as you probably recalled, Holland has really decreased their consumption of antimicrobials. And here's the resistance patterns for various kinds of antimicrobials in the live veal calves. This is just an example I just took, huh? And then this is from the veal, I mean from the meat itself. And there you can see how the resistance has actually decreased over time. I'm going to show you an example that's totally illogical. It's from Denmark. It's broiler meat in Denmark. We have the Danish down here, and then we have some imported. What I want you to concentrate on is Danish meat. And it's the prevalence of ESBL. And what we were really wondering was, how could there be ESBL in Danish broiler meat? At those levels, we haven't been using cephalosporin for years. And it showed up that their grandparents in Scotland had been treated with cephalosporins. Their grandparents' breeder eggs are exported to Sweden, where they don't use cephalosporins. They become new breeder hens, and they're then exported to Denmark. So this is just to say that we may be able to control our consumption in Denmark, but all countries are really dependent on each other. So relationships are not always linear. Then the second point that the European Commission was looking at was that they wanted to introduce recommendations for prudent use in veterinary medicine. They wanted to focus on responsible use, looking at that they think the overall use of antimicrobials should be reduced. And they say this is a national matter. They don't want to say exactly how the various countries should do it. It's the countries themselves that have to figure out doing it. They also think there should be guidelines for responsible use, which also should be the a national initiative. And then they're very concerned about what they call the critically important antimicrobials, which are critically important for human beings. They're really scared that they're used for treatment of animals. My colleague in the CVMP is a scientific committee which gives scientific advice to the European Council. He's told me that at the EU level, the focus lies where the highest consumption is, which is namely in the poultry and the pigs, so there the bovine can relax. However, on the national level, some other things may be going on. National initiatives to regulate the consumption is really going on quite hotly in the Nordic countries, in the Netherlands, in Germany it's happening, and in Belgium it seems as if they're getting a plan ready and they'll soon be going forward with that. These plans are usually driven by the industrial associations. By that I mean the livestock sectors themselves that are involved in it. It's the authorities, the politicians are there. The media also have a strong influence on how much things are going on. The media are really driving hard on the livestock sector in Denmark, for example. And its feelings also, because the public also have a lot to say. So for some other reason, there's not any regulation going on in companion animals. And a lot is going on, for example, with the swine, because the swine are dirty. The sweet dog, we don't want to regulate anything on that, for example. These ways of regulating are very different between countries. For example, in Denmark, we love football, and the government loves it too. And they love bans. So when a herds owner, he uses too much, he gets a yellow card. And the livestock sector also puts a lot of regulations on the farmers. In the Holland, it seems as if it's been a more cooperative initiative where the government set some goals, and then the Veterinary Association and the 4 livestock sectors went together and made some plans. In Germany, which is very, very new, it's just coming up that they want to regulate more. It seems as if it's more, I wouldn't say relaxed, but it's not as intensive as in Holland and Denmark, for example. Some national regulations, just to show you some examples, because each country can press just the buttons they want to regulate the antimicrobial consumption. I'm just going to quickly give you some examples. The first thing was that you could, for example, put reduction targets. So the government could, or the authorities could, for example, say it has to be reduced with a specific amount over a number of years. That's happened in Denmark and in Holland. Then the surveillance could be, they can monitor the surveillance of antimicrobials at the farm and species level. That's happened in Denmark and in Holland. And it seems as if that's also a plan in Germany, but not as intensive, because in Germany, the farmer only has to report every half year what he's been using. In Holland and in Denmark, it's continuous monitoring. Then the farms can be benchmarked against each other, as I showed for Denmark, and that's Denmark and Holland, and it seems as if the Germans also have some plans. Then the veterinarians can be benchmarked, and that's something that Holland wants to do, or they are doing. In Denmark, veterinarians cannot profit on the sales of antimicrobials at all, and I think that's more or less almost the only country in of these 3 here. Holland doesn't have that. The ban on cephalosporins and fluoroquinolones goes for Holland and Denmark. And Holland actually says that new antibiotics that are developed are not allowed to be used for veterinary practice. Restrictions on colistin, plumutulin, and beta-lactams, that's Holland that's implementing that. And restrictions on tetracyclines is really going on in Denmark. The swine, the livestock sector of swine says that their use of tetracyclines has to be halved during the next year. Formularies, which Bart told you about, where you say that, well, if you have this disease, if this indication, you want to treat for this, you have to use this as your first choice. If it doesn't work, then you may use this, and if that doesn't work, then you may use this. That's only Holland that's implemented that. And then there's the one-to-one association between vets and the farmers, highly prioritized in all 3 countries. Penalties, as I told you, that's very Danish. I put on the Dutch and the German, you know, a little bit shadowy or blurred because they're talking a little bit about it. So what I'm trying to show you here is that you can see it varies, the flags vary. It's very different ways of regulating the consumption of antibiotics. Seems to be a little bit of competition between countries when they sort of present their things. The Danes think they're great, they're the first ones there. The Belgians may have done something else that they're really proud of. The Dutch, they say they did something better, and so on. The problem, I think, is that we really need to talk together and harmonize things, agree on things, and I don't think the harmonization is as good as it could be. What is all the same thing all the way through is that regulations lie where the total consumption is highest. And now I've taken an example for pigs in Denmark, or for Denmark, sorry, where you can see that pigs, the most of the consumption of antibiotics is for pigs, and that's also where we have the highest level of regulation. For example, the use of fluoroquinolones and cephalosporins are banned in Denmark for the treatment of pigs. The yellow card system with punishment systems we have taxes on the antibiotics, and we have restrictions on the use of flock medication for swine in Denmark. What about the cattle? There are also some threshold limits that the Danish bovine practitioners have to adjust their use for. And they have been more or less the same through the last 4 years. And since 2006, mastitis treatment has been restricted to simple penicillins unless laboratory analysis indicates otherwise. They have strict veterinary herd visit agreements so that Danish cattle farms are mostly actually almost visited every 14th day, I would say. And since August 2014, the bovine livestock sector themselves chose to make a voluntary ban on the 3rd and 4th generation of cephalosporins. Now, I just want to tell you that lobbyism really sometimes pays off, because that the cattle practitioners have been really tired of the very low threshold limit for calves. There was not room for responsible treatment of pneumonia, and it seems as if they've succeeded, and possibly in 2015 the threshold limit is actually going to be raised, so there'll be more room for treatment of pneumonic, for example, calves. That's really nice. Guidelines for prudent use of antibiotics, that is on a national initiative driven by especially industrial associations and veterinary associations. And they will focus on things like best treatment guidelines to assure that animals are not underdosage. They will focus on, for example, what is good and bad antibiotics. They may also focus on less flock and group medication. And in the future, the European Commission intends to make guidelines and audit the implementation in the member states. And they don't like preventive use of antibiotics. They say it's okay with metaphylactic use, and of course, use of antibiotics for treatment of sick animals. Then they have focus, of course, on critically important antibiotics, as I mentioned. And in 2015, on the cattle segment, they want to revise. This is a CVMP that's working on that. The CVMP, their scientific support group, you can call. They're going to revise the guideline on antimammary treatment, and they're going to have focus on ESBLs and 3rd and 4th generation cephalosporins. And other antibiotics that they've had in the spotlight has been colistin, pleromutulins, quinolones, macrolides, and nicosamides, but they seem to have taken a fairly pragmatic vision on that. Now, if we look which countries use cephalosporins, that is the southern part of Europe, you can see. And I think you that live down there, you have to be ready for that. You'll probably be restricted in your use of cephalosporin within not too long time. The development of new products, there the European Commission has focused on innovation and investment. They want to support the production or the invention of new antibiotics. However, I think they're a little bit controversial on that, because at the same time, as you could hear, they sort of saved things for human use. And I mean, what is reaction from the pharmaceutical industry? They don't want to invest in something that they can't sell. So it's really hampered the innovation by new classes set aside for human use. And it's even really difficult to get new indications on antibiotics. So I don't think you're going to have many new antibiotics, if any, to work with in the future. Then they want new diagnostic tools for quick, accurate identification of pathogens. And then they want you to use some more vaccines and other preventive measures. Then, right at present, the Veterinary Medicines legislation and the Medicated Feed legislation has been out in the new hearing. But all this is so premature. There's been the first reading in the European Commission. It's going to take 1 to 1.5 years before this is ready. But I can tell you some of the things that they're focusing on. They're focusing on removing the cascade rule. But on the other hand, they want to restrict you on your off-label use of products, for example, using it for too long time or in other dosages than they're registered for. They're putting an emphasis on that the pharmaceutical industry, if they do produce new antibiotics, that there has to be a risk analysis on these antibiotics to make completely sure that these new antibiotics, veterinary use is of no hazard for the human beings in Europe. And they want warnings and guidance on labels. And in the medicated food, they want to make sure that there's almost no carryover from medicated food to non-medicated food at the production sites, to make sure that non-target animals do not receive antibiotics. The last point they're looking at is infection control and prevention. And as Bart said, one of their buzz slogans is that prevention is better than cure. They write that all the time. So they want improved health and biosecurity measures, which I'm sure you're all working at. That's probably your daily work. Better herd management, feeding strategies, breeding and stuff like that. Fluffy words, they say. And they want promoting of the use of vaccines. So just my conclusive slide here. There are continuously growing restrictions on the use of antibiotics in veterinary medicine. There will be fewer antibiotics available for you to use. And alternatives to antibiotics and preventive measures like vaccines, they'll be the future for you. Yeah, that was all. Thank you very much.